It's the diagnosis no one wants to hear: cancer. Tumors can form anywhere in the body at any age and can be treated a variety of ways if they are detected early enough. When tumors form in the brain, the consequences can be deadly and the treatments limited.
Brain tumors are often infiltrative of normal brain cells, and this is a major challenge because even if you remove them, they tend to recur, and they are very non-responsive to adjuvant treatment like radiations or chemotherapy.
Dr. Emilio Nardoni is a neurosurgeon in Bloomington, Illinois. His training and experience have prepared him to manage especially challenging cases.
We're ready to start the surgery.
On this day, the case he has before him is an adult male with a malignant brain tumor called glioblastoma. It is the most common brain tumor in adulthood.
It's a very aggressive tumor. Not many treatments available that are very effective to effectively treat it. And surgery is probably the best treatment because the longest survival is associated with an aggressive removal of the tumor. The options for this type of brain tumors are surgery, radiation, and chemotherapy. There are other experimental options, but the mainstay of treatment is the three options I mentioned before. Surgery, by providing a gross total resection of this tumor, is probably the treatment that provides the longest survival.
The size and exact location of the tumor will determine the surgical approach.
The approach we're going to do today is called left frontal temporal craniotomy. This means we're going to remove the skull to access the tumor that is located into the temporal lobe, and once we have resected the tumor, we will close and put everything together.
Prior to beginning the surgery, Dr. Nardoni takes one more look at the MRI to confirm his approach and prepare for the resection.
For the brain, and we'll see the tumor in the left temporal lobe here. And this is the bottom part, and then as we come up, we can see more images of the tumor located in the middle portion of the left temporal lobe. And then the tumor disappears at this point. So the goal of the surgery will be to remove this tumor altogether with the surrounding tissue and do a partial left temporal lobectomy.
Once the skull has been removed, Dr. Nardoni uses ultrasound to pinpoint the precise location of the tumor.
You see what seems to be a ball in the middle of our field there? That's the tumor. We are just overlying the tumor with the probe here. That's all tumor. And then coming forward, there's brain, normal brain. So we know the tumor borders. Going backwards, that's the brain again. So we know the tumor stops right there. Now we know where to go.
Now that the precise location of the tumor has been determined, Dr. Nardoni strategizes his approach in order to minimize post-surgical complications for the patient.
We're going to go posterior to it. One of the questions will be, what are the possible deficits in removing some brain around the tumor? And you know, in this location, as long as you stay within 5 centimeters from the tip of the temporal lobe, we should be pretty safe. Although this is the left side of the brain, it is the dominant part of the brain for this gentleman.
A little over 3 hours later, the tumor has been removed and the skull is ready to be closed.
This one should be more or less normal, yeah. The tumor is gone.
But even when surgery is the best option, the prognosis is not always promising.
Malignant brain tumors are highly challenging, and the prognosis is not remarkably improved through years because they are highly infiltrative of the brain. And because of that, even when you achieve a gross total resection, there are still cells left that will survive and will continue to grow, forming another tumor. And also, these tumors don't respond to treatment very well. The outcome for this kind of cases is directly related to the malignancy of the tumor. And as I mentioned before, this tumor is highly malignant, and the glioblastoma multiforme, unfortunately, has only an average of 12 months life expectancy after best treatment is provided.
Some brain tumors can be treated with non-invasive methods of radiation that have proven effective.
The tumor that we can treat with gamma knife or cyber knife, or in general with stereotactic radiosurgery, are not an infiltrative brain tumor like the one we're going to do today. They are typically meningiomas or tumors arising from nerves, like acoustic neuromas. Those are the lesions and the tumors that respond the best to the stereotactic radiosurgery, including arteriovenous malformation of the brain.
Research promoted and supported by the Central Illinois Neuroscience Foundation is underway in an effort to decrease the rate of recurrence of tumors following surgery.
At the present time, we are conducting clinical research with the CyberKnife using for the treatment of the tumor's bed after a metastasis has been resected, and see if by using this adjuvant treatment we can decrease the local recurrence rate.
Dr. Nardoni says it's important for the public to know that brain tumors are more common than we think, but that each case presents its own challenges.
They are very challenging due to their resistance to multiple treatments. In most brain tumors, the prognosis is directly related to the extent of surgical resection. And that's why I recommend an aggressive resection of these lesions to remove at least what we call a 98% of the lesion.
As research advances in hopes of learning more about the causes and potential cures of brain tumors, Central Illinois Neuroscience Foundation will be at the forefront in an effort to maintain quality neural health care in Central Illinois. To learn more, visit cinf.org.